All right. I think we are finally live, so I'm going to go ahead and kick it off. Thank you to everybody for joining us. This is a joint briefing between the subcommittees of Health and Social Services on Appropriations and I believe Public Health on HGO. And it is to review the ongoing concerns and progress that is being made with regard to Optum's servicing of as an ASO for the behavioral health Medicaid program. So we're going to have three panels today. We're going to have a panel with the department. We're going to have a panel with Optum itself, and we are going to have a panel with providers. And so what I would like all the committee members to do, if you can, is hold your questions until the end of each panel for that individual's or for that group's testimony, and then we will go from there. And I will also, just as a warning to everyone, I am going to go mute because my landscaper is mowing right outside my window. So I apologize, and I'm going to go mute. It's going to be very loud. So why don't we go ahead and kick it off? We'll start with the department. We have here Steve Hsu and Webster Yee from the department. We will kick it to you, gentlemen, to start off on the presentation and go from there. Thank you.
Thank you, and good morning, Chairs Resnick and Pena-Melnick. We're delighted to be with you this morning. We appreciate the opportunity to brief the two committees on our progress with the Behavioral Health Administrative Services Organization. I'm Steve Hsu, as the chair mentioned, Deputy Secretary for Healthcare Financing and Medicaid. I am the State Medicaid Director. With me are my colleagues, Webster Yee, Assistant Secretary for Health Policy, and Chad Burkholder, Chief Operating Officer of Optum Behavioral Health. We characterize 2021 as a year of steady progress and continual improvement in our Behavioral Health Administrative Services Organization, or ASO. We thank United Health Group, Optum Behavioral Health, for its dedication to technical and process improvements, and our providers for their continued feedback. Since January 2020, the ASO has received and processed over 17 million claims, made over $2.9 billion in payments to over 2,600 providers, and continue to average $30 to $40 million a week in payments for actual claims for care since the beginning of real-time claims processing in July of 2020. This is in line with historical averages. Importantly, 98% of all provider claims are adjudicated within 14 days, well within industry standards. We continue to focus on maintaining an ASO that pays valid claims from providers accurately, consistently, efficiently, and transparently. With regard to accuracy, claims are properly processed according to the system rules and the clinical judgments contained within medical necessity criteria. In terms of consistency, claims with the same characteristics processed in the same manner so that providers can resolve issues with their claim submissions. Efficiency, claims processing occurs with minimal human intervention and without additional inputs beyond those needed to process the claims. And finally, transparency, providers are given visibility into the status and details of their claim relevant to processing in a timely manner. We continue our regular provider and stakeholder meeting cadence, which we appreciate very much, by the way. That was started over 2 years ago and continually seek to improve on identified issues in a collaborative fashion with all parties. Looking forward, we are laser focused on 3 areas: making continued system improvements to ensure that the ASO meets our previously described 4 claims processing objectives, commencing the recoupment sequence of the 2020 estimated payments in December 2021, and development of the request for proposal, or RFP, process to ensure that we are well prepared for the end of this contract in 2024. At the initial launch of the UHG Optum system in January 2020, the system had technical and system failures that impacted behavioral health providers. As a result, MDH directed UHG Optum to make weekly estimated payments to behavioral health providers beginning on January 23rd, 2020, and continuing through August 3rd of 2020 based on their 2019 historical average payments. This resulted in a total of $1.1 billion in estimated payments during this period. As part of the reconciliation process for this period, UHG Optum and MDH worked over the past year to reconcile the $1.6 billion worth of provider claims against the estimated payment total. Over the past year, we've reduced the outstanding balance of overpayments to providers with estimated payments to approximately $230 million owed to the state as of October 2021 from $360 million owed in October of 2020. A large portion of these payments is concentrated among 44 providers that account for $83 million of the outstanding balance. A key reconciliation goal has been the delivery of the 835 healthcare claim payments transactions for electronic data interchange claims, more commonly known as 835 reports. These 835 reports, in addition to the Provider Remittance Advice, or PRA reports, have now been delivered to the overwhelming majority of claims and providers as of the weekend of October 24th. Very important. The 835 reports will enable providers, especially those with more complex accounting and claims systems, to review and reconcile their internal reconciliation between actual claims submitted and payments from the estimated claims payment period. Maryland has a legal and moral responsibility to our federal and state taxpayers to recoup the differences in the estimated claims and the actual claims submitted. As previously announced, in recognition of the challenges caused by repayment, MDH is forgiving the debt for eligible providers owing $10,000 or less. As a result, more than 42%, or 907 providers with outstanding balances, will owe nothing. We believe this action will eliminate the burden on small community-based providers. All providers owing $10,000 or less will have their balances cleared, with the exception of a few categories: hospitals, laboratories, somatic behavioral health providers, out-of-state providers, and providers who have not yet submitted claims against any of the estimated claims paid. For providers who owe more than $10,000, they will have one of three options for repayment: payment in full at the time of notice, a 12-month interest-free repayment plan, or the option to credit current claims paid to offset all or some of the balances owed over a 12-month period, with final payment to be completed in 12 months. We will formally commence the recoupment process this December, and will work with providers over the course of the winter by sequencing our recoupment actions to enact a repayment plan with all providers. We have Optum reconciliation managers that will work with providers in this process. There are several key components to the recoupment sequence. We're engaging in active discussions with provider representatives regarding additional partial forgiveness for providers with between $10,000 and $50,000 outstanding, and will evaluate providing additional relief. We are also discussing possible forgiveness for providers that have already paid their outstanding balances of $10,000 or less, and partial forgiveness for providers that have already paid their outstanding balances of between $10,000 and $50,000. Providers that have submitted no claims against their outstanding balances will be required to pay their outstanding balances on or before December 1st, but not later than December 31st. Providers that are in possession of duplicate payments will be expected to repay such payments on or before December 1st, but again, not later than December 31st. Providers with outstanding balances will be required to begin repayment of such balances at a date that will be announced on or about December 1st, but we expect such repayment to begin in the spring. Again, once recoupment of outstanding balances commences, providers will have up to 1 year to repay in installments without interest. As part of this reconciliation effort, we have engaged the Office of Administrative Hearings, OAH, to assist with third-party mediation. The key lesson learned from the transition of the previous ASO vendor to the current vendor is that we lacked the time to design, develop, and implement the UHG Optum system thoroughly. The UHG Optum contract ends on December 31st, 2024. MDH is using the lessons learned from the current contract implementation, input from the behavioral health provider community, and the need to include an evaluation of past performance in similar contracts to begin the request for proposal, or RFP, and procurement process now. Our goal is to develop the RFP and to solicit bids in 2022, select a vendor, and begin design, development, and implementation in 2023. Provided the system is tested and accepted, it may be online as soon as the 2023 to 2024 time period. All competitive bids will be reviewed on a technical and financial basis in line with state procurement law and regulations. We'll be sending out a provider survey later this year as part of the RFP development process. For more details, please refer to our attached backup materials, including the October 1st Joint Chairman's Report. Thank you for the opportunity to update the committee. My colleagues and I'd be happy to take any questions. Thank you.
Thank you for that presentation. We really appreciate it. Why don't we open it up to questions for the department only? I know Mr. Burkhalter is going to come on afterwards to do his presentation. So if anybody we have questions. We'll start with the Vice Chair, Geraldine Valentino-Smith. Delegate Valentino-Smith, please go ahead.
Thank you, Mr. Chair. I'll try to hold it to 2 questions. I know we've got a lot of panels to come. So thank you, Mr. Hsu and the department. I wanted to focus on the slide that you showed us that talked about systems improvement. And it looks like you're basing your decision that Optum is doing well based on their claims processing. But are they showing you claim data that includes claims that are still in process as you're making that decision? In terms of their performance data, I guess what I'm asking you is, are you making your decision that they're doing well based on information that they're reporting you about process claims? And are you seeing how many claims are not processed or are in process when you're making your decision that they're performing?
We do receive data on claims that are being processed. We also receive data on claims that have been denied.
So could prepare another slide and send it to us that actually shows us, we're going to hear a tale of 2 stories.
Mark, you can come out.
And it looks like you're telling us they're performing, and I think we're going to hear from the providers they don't.
Just listening, so you can come out.
And that your decision and your performance evaluation is not including how many claims are still in process.
We'll be happy to follow up on that, Delegate. I'm not sure exactly what you're getting at. It may be, I think the reference may be to denials. And there is a very large number of claims that are denied, that have been denied. We know a portion of them need to be reprocessed and may be actually entitled to payment. And I expect you will hear some of those types of concerns when the stakeholders testify in the next panel. We do get regular reporting on those numbers, so we're not in the dark about them. But it has been the large number of denials has been a source of frustration, I know, for the stakeholders
and the amount that remain in process. Okay, so I see other hands up. Let me ask you this. I see an October 4th department transmittal to Medicaid providers. And it says the state has a legal and moral responsibility to Maryland taxpayers to recoup these funds. So you're talking about this responsibility, and I know you described what your forgiveness is. So I want to ask you what the legal and moral responsibility is to exact damages from the contractor for non-compliance and for not meeting the requirements that they were supposed to, for all the damages that have resulted, to collect. The taxpayers aren't responsible then for that you are going after Optum for non-compliance. And at what point in the contract are you able to require them to change their subcontractor in Cato or to get more liquidated damages? And have you been aggressively doing that as your responsibility to the taxpayers?
Thank you, Delegate, for the question. In terms of in Cato, and for those that aren't familiar, Cato is a subcontractor to UHG Optum that provides critical functionality to the claims processing system, and the difficulties we have all had are generally focused on that subcontract within Cato. We have evaluated the possibility of asking Optum to exchange out in Cato for another subcontractor. At this late point in the contract cycle, we've concluded that it is simply not practical. By the time we evaluated other subcontractors, engaged a subcontractor, their system, we would in effect have run through our RFP cycle, which is precisely why we've begun the RFP in lieu of that action. Moreover, I think we would all be rather hesitant to bring in a new system, a new processing system that might go wrong and then subject the providers to another generation of problems. As far as the comment that I made about a moral and legal responsibility, what I'm referring to there is that the state, mainly because of underutilization of healthcare services, end up paying the providers much more money than they were entitled to, because we were basing the payments on historical volumes back in 2019. So substantially more than $300 million was overpaid, and as I mentioned, that number has now been whittled down over time to $230 million approximately. And it's important for us to get that money back because
I just think what I'm asking you is, given the responsibility that you're exacting on the providers, I'm asking you what your responsibility is then with the taxpayer money to collect damages, collect liquidated damages, collect punitive damages. What contract do you have to collect that same responsibility from Optum and get that money back to the state, which I think then can be used to help the providers? But what's your responsibility to collect damages, punitive, liquidated, whatever you've got? They didn't do what they were supposed to do. They're not doing it. Are you still paying them, or are you collecting damages from them?
Madam Vice Chair, this is Webster Yee with the department. We are in close consultation with our attorney generals. We are reserving all legal rights and remedies, and we will take action as appropriate.
So you've taken none thus far with respect to noncompliance?
That is a bit of an unclear term, Madam Vice Chair. We'd be happy to engage in an offline discussion about the actions that we have taken, but insofar as we want to ensure that the state's legal rights and remedies are protected, at this point, we want to be very clear about what we say. So we'd be happy to have an offline conversation with you about those actions.
Thank you, Mr.
Thank you. I believe Delegate Henson was next.
Madam Chair. Thank you, Mr. Assistant Secretary and Mr. Shu. My question is about the timeline that was mentioned and raised. You mentioned that as of October 24th, the remittance notices and then the 835s went out to the providers. I've gotten communications from providers as recent as October 29th that they don't have the information that they need to reconcile their books. What assurances do you have that those notices went out to the providers?
The estimate I was given 2 days ago is that all the 835s have been delivered except for approximately 1/2 of 1 day of claims. And as you know, we process about 30 to 40 million of claims a day, so a week. So approximately half of 1 day, to put it in context, is all that has not been delivered. So I presume you were hearing from that small group, and Optum is working diligently to deliver those final 835s. We're down to the very short strokes on the 835s. Maybe Mr. Burkholder can comment further when he starts his panel, he's part of this panel. If you would like him to comment now.
Yes, sir. Notwithstanding the 1/2 of 1 day, I would encourage just making sure that those notices have gone out, because the timeline you laid out after that is a pretty quick escalation. It starts with the notices on December 1st, and then the first of those repayments starting on December 31st. That leaves very little time to reconcile the books. With some of the smaller providers, what I've heard is that they have had to pull staff from doing critical work to be able to go through and to dedicate to reviewing the claims, that it leaves them in a position where if the only options they have are accepting what's presented to them or challenging it and kicking it to OAH, that what they'll have to do is challenge it and kick it to OAH. And we certainly don't want to create a backlog there. We want to empower them to go through with specificity and to have the information that they need to be able to do that. And what I'm hearing is that all that information had not made its way to our providers as recent as October 29th. Thank you.
Delegate Henson, this is Webster. Again, just to be very clear, as my colleague, Mr. Shu, said, we are starting in December, but this process will really start taking off closer towards the spring. This is going to be a very deliberate process by which we start with, if you will, a smaller sets of groups of folks in December, and then we go onwards towards the spring. So to be very clear, the process begins in December, but we expect this to take a while. So it's not going to be a hard cliff.
Delegate Henson, are you done with your questioning?
Yes, Mr. Chair. Thank you.
Great. Thank you so much. I believe Delegate Bagnall was next, then Delegate Johnson, then Delegate Hill. So Delegate Bagnall.
Thank you, Mr. Chair, and thank you for your presentation being here. To my colleague's point, I do believe we are going to hear a tale of two experiences today. And so I hope that you will continue to make yourself available for questions as we hear more from the providers. But one of the things that we're hearing from the providers, and I didn't hear this addressed in your presentation, and I apologize if I missed it, is that Optum is still erroneously retracting 2019 claims that were paid correctly through Beacon. Can you speak to where we are in that assessment and the accuracy of that reporting that we're hearing from providers?
Yes, I think the reference is to what I refer to as Beacon carryover claims. In late 2019 and early 2020, there were claim submissions that were made during the transition from the Beacon system to the Optum system. And certain critical functionalities did not come online until approximately mid-January of 2020. So there were a period of weeks there where certain claims did not process properly. They were either misidentified as already having been paid and therefore were not paid, or other glitches of that sort that resulted in an inventory now of claims carryover Beacon claims that still have to be paid. I believe, Carl, Mr. Burkholder, correct me if I'm wrong, but I believe that total bucket of claims is about $5 million. So it's not huge, but most importantly, now that we've figured it out, I believe that issue will be resolved and those claims paid in a matter of weeks.
And can you give us some assurances? I'm sorry, Mr. Burkholder, you can go ahead and speak to that.
Just to support the Deputy Secretary's comments there, you're correct. As a general summary, the Beacon historical claims totaled in the neighborhood of about $1.7 billion. And right now, the specific issue that Deputy Secretary mentioned is currently actually being corrected as we speak and will be complete within the coming days or a couple of weeks. And that's actually about a total of about $1.8 million. And in terms of paid Beacon claims that were loaded as paid, but that was incorrect. And then similarly, there's about $430,000 in third-party liability coordination that's underway. So you can see there about $2.2 million worth of claims, which will be completed in very short order on the magnitude of the total 1.7 billion that was a part of that Beacon historical. Hopefully that context is helpful.
It is, and I appreciate that, because obviously, in our large budget, when we're talking millions of dollars, it is not as impactful as the budget of the providers themselves. Of course. And I just had one quick follow-up because you talked about payments for providers who have not submitted any claims, which I think is a little bit of alarming to hear. Can you speak to what universe that is? How many providers we're actually talking about who have been paid but have not submitted any claims for the duration of 2020, January 2020 to November 2021?
Delegate, are you directing your question to Mr. Burkholder or to MDH? I'm sorry.
MDH, thank you.
Okay. Mr. Burkholder may have more to add, but these are providers who have not submitted any claims in recent times. They've either left the business, gone defunct, or are running for it. And since they have submitted no claims, all the estimated payments given to them, they are not entitled to. None of it. In other words, if there was no service activity during the period over which they were receiving those dollars from the state, they're not entitled to those dollars, and they need to come back. Why we expect them to come back pretty soon.
I think we do understand that. My question is, what is the universe we're talking about? Like, what is the breadth of that issue?
Mr. Deputy Secretary, would you mind if I supported you in the answer?
Go ahead, please.
So right now, there's about 350 of those specific individuals who have not engaged in claim submission, Delegate.
Thank you. Thank you very much, Mr. Chair.
Thank you. Delegate Johnson.
That's about $9 million.
Thank you, Mr. Chairman. I'm going to go back to the slide that you presented that showed claims that were submitted and claims that were adjudicated within the 14 days. When I've spoken with several mental health providers, and when they submit a claim or a corrected claim, it seems that that is not linked to the original claim. It has a different claim number on it. So is that then your slide not skewed on the claims that were processed and staying within the 14 days? And I would also like to know what % of the providers qualify for the forgiveness, and what does it mean when your third-party mediation? Does that mean that the providers have to go out and hire an attorney? Because I want to make sure we get an accurate as possible picture of what's going on here today.
Let me comment on the second two items. In the mediation process, it is being handled by the Office of administrative hearings, no lawyers required. And we are trying to communicate that out to the provider community because there has been a lot of concern that they would have to engage an attorney. It does not. What was your second question? I'm sorry, could you
The
give me a
second
quick
question was, what percentage of providers qualify for the forgiveness?
It's about 42%,
Yes.
Delegate Johnson. And then to your first question, we're going to ask our colleague Chad to speak about it. Mr. Burkholder?
Sure. So I think what you're referring to, Delegate, is in the situations where a claim is first adjudicated and then subsequently down the road needs to be re-adjudicated for some reason. That did occur during especially the estimated payment period, where system instability was certainly more present. Since August of last year to present, that has improved greatly. Now, our inventory management has been excellent. In fact, overall, on average, providers are receiving payment between 8 to 10 days after submission on claims that are currently paid. Our inventories are, as has already been pointed out, are typically being processed, 98, 99, even 100% well within those 14 days. So thankfully, amongst all the many different challenges that have occurred, I can say that inventory management has not been one of those. Although I would acknowledge that as system defects were remediated and previous claims were corrected, maybe because of a system defect or potentially even because of resubmission by a provider, that would look like a claim which may have taken place in the past that's being processed in more recent times. But thankfully, that is not a common occurrence.
If I can jump in very quickly, I think we've gone a little off stray. Based on the agenda that we had, Mr. Burkholder is going to have an opportunity to make his own presentation and answer questions from the panel directly. So why don't we keep this part of the questioning to the department? And then once that is concluded, we will turn it over to Mr. Burkholder and go from there. Okay. Delegate Johnson, do you have any follow-up questions?
I do, just one quick one. You said, Webster, that this process is going to take a while, but yet the providers are having to start paying December 1st to December 31st. When has all of the reconciliation been done so they know an accurate number to start paying on? And I don't understand, it almost is like the cart before the horse, with them having to start paying between December 1st and 31st when all of the reconciliation has not been done. They were supposed to, Optum was supposed to help these providers with the reconciliation. That's what we were told in the committee. And that is still not completed. That is still not done. And we're almost 2 years later. So if somebody can speak on those timeframes of payment, getting paid and the reconciliation, so we can get that straightened out.
Yeah, thank you, Delegate.
Go ahead.
I'm really glad you asked this because this is very important information, and we do need to communicate it broadly in the provider community. The only collecting that we are planning is, as I mentioned earlier, providers that have submitted no claims and for whom the estimated payments are totally inappropriate and should be returned immediately to the state. There's no reason why we should not commence the collection of those dollars. Similarly, the second bucket is duplicates. Some payments were made in duplicate and shouldn't have been paid at all. There is no disagreement that I'm aware of with any provider that they're entitled to retain a duplicate payment for a claim. Many of them have been just paying those back of their own volition, including a very large repayment by Shepherd Pratt just last week. So the vast majority of collections is for providers with outstanding balances who are still submitting claims. That's the $230 million. That process will not begin until the spring. And we will try to announce on or about December 1st the more exact dates around that collection process, but that's what we are anticipating. So I think the providers can be very relieved by that expected timing.
Okay, if I may just go back to the one other question that I asked about the mediation. I'm looking at a document from the Office of Administrative Hearings, and it says important things to know about OAH process. Corporations must be represented by an attorney. If you don't appeal, you lose the ability to be reimbursed for the claims in the MDH notice. So that would appear to me that they would have to be represented in a mediation by an attorney.
Delegate Johnson, I think the key point is this is mediation, not an administrative hearing. That's a separate process. As Mr. Hsu pointed out, you do not need an attorney for the mediation process. This is mediation, not an administrative hearing.
All right, thank you, gentlemen.
Delegate Hill, I know you're next, but I'd like to follow up if I can on that very point, if I may. As you all know, the Office of Administrative Hearings is presided over by judges, administrative judges. To suggest, and I know this because I happen to be a trained mediator in addition to being a licensed attorney. And attorneys are often involved in the mediation process. So to suggest that somehow mediation automatically evaporates the need for attorneys is circumspect at best. Will the department have its lawyers there?
Delegate Resnick, I think it's important to note that this is a separate agreement that we entered into as an MOU with the Office of Administrative Hearing for them to provide mediation services.
And if I recall, there was budget language requiring an independent, neutral, third-party mediator to be hired by the department.
And we believe that the Office of the Administrative Hearings meets that requirement, sir.
Okay.
I don't think there's any question as to them not being independent or a third party. And we have retained their services to provide these mediation services. We looked at our other options, and to go through the procurement process would have put this significantly back in time.
Can you assure the providers the department will not have any attorneys there on your side?
That's a good question, sir. I'll check into that.
Okay. Also check into, if you do have attorneys on your side, will you be paying for attorneys for the providers as well? Okay. Thank you. Delegate Hill, go ahead.
Thank you, Mr. Chairman, and thank you for that line of questioning. Mr. Hsu, I'm a little bit confused. I understand that you've got 350 folks who haven't billed recently and have been given anticipatory payments. And those, I think you said, come out to about 9 million, and you're expecting them to begin repaying. What I'm confused about, first of all, is that there is a history here, pre-Optum, going into Beacon, where there are providers that have claims that were never satisfied. So I'm first confused about whether the number that you presented today of providers who have been overpaid includes credits for payments they should have received that they never did. I didn't hear whether it's just you all looking at this year and saying they haven't billed, we shouldn't have paid them anything, or you've looked at their entire record, including claims that they may still have pending of what the department still owes them.
Yeah, thank you, Delegate. The providers that I'm referring to, these no claims submitted providers, is an entirely separate category of provider from the others we've talked about. This is a group of providers that have left the business, are inactive, maybe they've gone under, Some of them are engaged with us in discussions, so we just, even though they're no longer submitting claims and maybe no longer active in this particular business, they may have other businesses. But most of them, the vast majority of them, have made no contact with us, have not responded to us. We don't know if they even still exist. So there's going to be quite a bit of rigmarole around trying to collect, but we're going to do our best. But those providers, just to be clear, have submitted no claims whatsoever. They're utterly inactive. So it's not that they haven't been denied. They have not even submitted a claim.
No, I get that. And in the years that we're talking about, 2020, 2021, they haven't submitted a claim. What I'm not clear about, if they were provided, first of all, you were still carrying them. So they presumably submitted claims, at least under Beacon. And it's not clear that you all know whether they were still owed money when they disappeared, whether they, as you said, they may have gone under. I want to know if you looked at, or if you are looking at, to see whether there were claims. In other words, if they went under, could it have been because they had been owed money that they were never paid? And are we trying to make sure that we're just in making sure that even going after this group of folks, that we don't also owe them money? Maybe that they net still owe us something, but are we looking at missed payments?
I mean, it could be. Yeah, it's an interesting question, Delegate. I suppose it's theoretically possible that some of those no claims providers could have been active during late 2019 and the first couple of weeks of 2020, and are in that pot of Beacon carryover claims that we discussed earlier. It's a small number. It's only $5 million out of this enormous sum of money in total, and a lot of that has already been cleared. And whatever remains of it, as Mr. Burkholder said, that's going to be resolved in a matter of weeks. So if they are entitled to any payment from the Beacon carryover period, they'll get it, and it'll either be credited to them or paid.
Okay, so that's all right. So that's what you're claiming you're going to say here, and I think we can hold you to that, because what I'm seeing is a legacy problem. And that we've all heard from providers complaining not about estimated payments coming in, but about actual claims for services provided that have not been paid. And it's not clear to me that those have ever been reconciled. So if we were doing that with Beacon and we have all these additional problems with Optum, I don't misunderstand me. I want the state to get the money it's owed and money that it advanced inappropriately or was later found not to have been appropriately advanced. But I'm also concerned about providers who provided services that have not or are not being paid. Now, I'm going to, if I may, Mr. Chair, I have a letter here from a provider. And one of the things, this letter from a week ago, so it's not from 2-3 months ago, it's from a week ago. It says, now we are faced with paying back the estimated payments without the information needed to check Optum's math. And I don't care whether it's Optum's math or MDH's math, the providers ought to be allowed to make sure that your numbers fit with theirs. So it says, once again, as I left the beginning of the letter out, despite promises that providers would be given the claims history needed to reconcile what we received and what, if anything, we owe, Optum is still unable to provide this basic and essential information. Please note the only recourse we have if we disagree with those numbers or the lack of information is to appeal to the OAH. And I understand Mr. Yee saying that they can appeal to them, but it's going to be a mediation process and therefore whatever. Well, and they're pointing out, as Mr. Chairman pointed out, that requires us to hire legal counsel. Mediation does require legal counsel. So again, I don't see a history where we've done well in making sure that when we say you owe us money, that we've looked at the entire balance sheet. And I'm asking for you, how do we know this time that even for those 350, we're looking at a full balance sheet?
Delegate, I think the exact answer to your question is the release of the 835 reports that Mr. Hsu described in his opening remarks. At the end of the day, there's 3 buckets, if you will, that we're talking about. And I think it's very important to try to keep this as close to apples as possible. There's the pre-Optum system, Beacon, There's as Mr. Hsu pointed out, a very small number of claims remaining from there. There's the estimated payments period, which was roughly the first 6 months of 2020, and that's the estimated payments and recoupment process. And again, with the release of the 835 reports, that is the way to start those conversations. And then there is the post-estimated payment section with the actual claims processing side of things. And under those business rules from approximately July onwards of 2020, the Optum system has been functioning as required. And I think it's very, to be very clear here, they are functioning as a claims processing system. They are reviewing claims for adequacy under business rules, and then they were going to review them under the 4 criteria that Mr. Hsu referenced, and then if the claims are not appropriately submitted, documented, et cetera, there is a industry system for denying claims. So that's the, I think, important distinction, sir. Ma'am.
Okay, thank you. I appreciate that. And if I may ask one other question, I would appreciate it if you could provide to this committee information about the number of claims in this current status after the prepayment period, the period we're in now, the number of claims, let's say through November or October 31st, the number of claims submitted, the number of claims denied, the number of claims appealed, and of those appeals, how many have been upheld and how many have been reversed. Because we're still hearing from providers that the current system of reimbursement is.
We'll be happy to work on that, Delegate.
All right, thank you. Thank you, Mr. Chair.
Thank you. And before we go to Delegate Peña-Milnick, I just want to reemphasize that appealing to a mediation process, and for all the lawyers that are in this Zoom right now, I mean, it's making my head explode. You cannot appeal to a mediation process. You can appeal from a mediation process. So maybe it's just a semantic issue that you are having and it's giving people heartburn, but you need to clear that up as to what this process is going to be and who is going to be there. Chair Peña-Milnick, please go ahead.
Thank you, Mr. Chairman, and good afternoon, everyone. I have a question. I always believe that, I mean, obviously from the questions and the testimony, and we're going to hear from the providers, there are still issues that are outstanding, right? How do we move forward? Tell me, when was the last time you met with the providers to discuss their concerns?
Last night, Madam Chair.
Excuse me?
Last night. We meet with providers on a weekly, bi-weekly, and monthly basis.
So when you met with them last night, what did they tell you about this issue?
Well, these are the issues we discuss at every meeting. We discuss each of these buckets, the actions being taken. We did let them know yesterday that we would be providing additional information about the timing of the sequence of events, which we discussed earlier, which pieces are part of the December 1st to December 31st repayment period, which parts are going out to the spring, which is the bulk of it. We discussed all of that last night. We have an excellent, I hope they agree. I feel like we have an excellent dialogue going with the providers, and they have provided invaluable input all along the way. And I think the helping us through the Beacon carryover claims was a particular success of those discussions.
So may I ask you a question? The Community Behavioral Health Association of Maryland gave you a proposal. Have you considered that proposal?
Which proposal, Delegate? I mean, we talk to them all the time, and they've made numerous suggestions, and we've taken many of them. Which one in particular are you referring to?
So which ones have you not taken?
Well, at one point there was a suggestion, I believe, by them that we just forgive all of this money, and we did not, for obvious reasons, take that suggestion. I think it was from Community Behavioral Health. I'm not 100% certain. We meet with the providers as a group.
So besides that suggestion about paying all the money, what other suggestions are outstanding that you have not done or have not considered? I mean, they're going to be on the next panel, so I'm going to ask the question, but I wanted to give you respectfully an opportunity to address it before they come on. And why will you not consider it? If it's okay, I can ask them and I will, but I just wanted to give you an opportunity because you're not coming back.
Well, Madam Vice Chair, we're happy to stay on the entire time and answer any questions and take any questions. I think, it's important to note that they are naturally advocating for their provider members. The state doesn't necessarily always have the exact, viewpoint that they will have. We certainly have discussions. They've brought up consideration of Encato. Mr. Hsu has answered that. We're happy. I mean, we've had numerous discussions and numerous proposals from CBH over the past almost 2 years to include, why don't we, violate procurement law and just maintain Beacon as the vendor, for example. So there's a lot of proposals out there. We're happy to discuss them with you, but we can't also say, hey, we're just going to do exactly what CBH wants us to do. That would be neglecting the state's interest.
And let me add that by far, in all of our conversations with providers and provider representatives, by far the biggest concern was when the process of collecting money for the overpayments would begin, the outstanding balances. And as per my prior remarks, we do not expect that to begin until spring. That issue has dominated all discussions with providers for understandable reasons.
Okay. All right. Thank you so much. I have a couple of questions for the providers. Thank you, Mr. Chairman.
Thank you, Delegate Peña-Melnick. All right, are there any further questions for the department? If not, why don't we move along to Mr. Brookholder as the Optum presenter, excuse me, and then we'll do questions for him, assuming there are any left at this point, afterwards. So Mr. Brookholder, please go ahead and take over.
Sure. Thank you, Mr. Chair. And to be clear, I was actually here to support the MDH panel, but I'll be glad to open with a couple of comments and then engage in any questions that you have. So I think that the Deputy Secretary and Mr. Yee summarized, the progress the way that we see it as well, in terms of being very distinct about the beacon period, the estimated payments period, and then the post estimated payments period. As things stand today, we frankly are pleased with the progress that is being made especially in the current time. We believe that the system is functioning, as Mr. Yee already outlined, is functioning on a very consistent basis. Payments are appropriate. Denials, where denials are taking place, the overwhelming majority continue to be driven by provider submissions. In some cases, we're able to work very actively with the provider community to correct certain items, have those things resubmitted. And in other cases, as has already been discussed, the amount of claims being impacted by quote unquote open defect is very, very small at this point. And you heard some of those data referred to by Deputy Secretary and Mr. Yee earlier on. That does not mean that we're in any way satisfied. And frankly, where we're at now is really wanting to create a focus on reconciliation and supporting the providers in that process. One of the things that I wanted to correct is comments were made that the only appeal is to the hearing board. That is definitely an incorrect summary. The first step of reconciliation is that we provide the providers with data and materials that give them a summary of their submissions and the outcomes of those submissions. Some of that is referred to as the 835 you've heard before. I certainly acknowledge that is a more recent completion. The providers will review that information. Where they see things that they don't agree with, they do not need to appeal that through the process that was mentioned previously as a first step. What the first step is one, we Optum will listen to the provider and they say, we don't agree with this outcome. Can you help us confirm why this outcome was appropriate? And we go back and we may say, oh, you're right, this is associated with a defect, or you're right, this is associated with human error, and that should be corrected, and we will go ahead and reprocess that and pay that for you. In other situations, we might say the system processed that denial correctly. However, if here's how it was submitted and here's why it was adjudicated that way, if there's a correction to the claim that you would like to make, you can make that correction now, and then we will go ahead and re-adjudicate the claim and potentially, according to business rules, if appropriate, then pay the claim. It's only after a time in which the providers have indicated that, they still disagree that those other forums would be necessary. So I just want to be clear that there are many, many steps before we get to a point where a provider feels as though their opportunity to evaluate the outcomes has been exhausted. So I think that's very, very important. The other element to that that I just want to be very clear about is we today, every single one of the providers, has an assigned reconciliation manager. And we're actually onboarding additional reconciliation managers as we speak right now to support as more providers we obviously expect and hope that they will engage in the process. So we have more individuals coming on board today. We are working very actively to support those discussions in a timely way. I would certainly submit that early on, almost a year ago now at this point, in the early days of engagement, there were delays. It was administratively cumbersome and awkward. We've really been trying to get to a point where we commit to the providers that we would be responsive in 3 to 5 business days. And we're actually operating around 2 to 3 business days in terms of our normal engagement with providers. Now, that doesn't mean there aren't significant assignments in between the engagements. So we may hand off information to the providers. We outline for them what the process will be for them to utilize the data they've been given, to examine, their submissions for accuracy and the data for accuracy, their accounts receivable. And then we may come back. That could be weeks in between, because certainly providers need the time to review their books. And so that kind of demonstrates the engagement between our organizations. Aside from that, I would, as I already mentioned, we've taken significant steps recently to re-examine prior denials associated with the estimated payments remaining balance. There was about $134 million of denials associated there. We went back and we re-examined and we've reprocessed $12 million worth of that. And the reason for that is we identified some of those other systematic challenges that were being addressed. We were able to reprocess those, but that really demonstrates that the material balance that remains in the denial space, we believe, was appropriately adjudicated in alignment with the state's business rules. So with that, I'll pause. There were a few elements I just wanted to clarify since they were topics of discussion earlier. Hopefully that addresses some of the questions that were previously asked. And I'll, of course, be happy to engage in any other questions that you may have now.
Okay, I'm starting to see questions pop up. We will start with Delegate Hill. I believe she was first, and then on to Delegate Valentino Smith.
Thank you, Mr. Chairman. Thank you, Mr. Bocoder. Again, I'm going to just read from constituent. Since Optum went live January 2020, it's been clear that the system could not meet basic functionality requirements needed to authorize services and pay claims. As a result, providers were given advanced or estimated payments. Despite numerous promises and deadlines set on Optum's part, their system continues, this is from a week ago, to malfunction, creating an expensive administrative nightmare for providers as we have to manually check and recheck the status of hundreds of thousands of claims. Our small 4-person billing department is exhausted. We find ourselves pulling staff from other critical functions to assist in digging through Optum's aftermath. So my question is, in the contract that you have with the state, what are you required to do for non-performance or underperformance, financially or otherwise? What is the remedy for the state for your failure unless you take issue and say that you have not failed in meeting your obligations?
Thank you for the question, Delegate Hill. So first of all, certainly I think that the legal elements, Mr. Yee and Deputy Secretary Shu already referenced that there are definitions in the contract around service level agreements. And the state has the opportunity and as the gentleman mentioned, the obligation to make sure that they assess appropriate penalties where those performance items are not met. You may also have heard in previous testimony that the state has chosen to withhold certain payments pending certain outcomes, and so that totals into the millions of dollars that has already been withheld. As to the specifics of the constituent that you mentioned, I think what they're specifically referring to is the worries that they have around the reconciliation process itself. I certainly would hope and I would encourage, if it's appropriate, if that individual is not today directly engaged with a reconciliation manager, we would want them to be. We think that that will help ease some of the administrative challenge. Absolutely acknowledge that the process of consuming the data and comparing the data is time consuming. It's certainly easier for some of the more sophisticated organizations to use their automation and their systems to help accomplish that. But I can imagine with a smaller provider that is much more challenging. But we would want to lean in and support them with our resources that we have available.
Thank you. Thank you, Mr. Chair.
Thank you.
Delegate Valentino Smith.
Thank you, Mr. Chairman. Mr. Burkholder, in the JCR report, there was a requirement that said the committee requested that we address steps made by MDH, and I'm just going to go ahead and read it so that we're clear. During the reconciliation process, including confirming that MDH and the BHASO have provided behavioral health providers with a comprehensive claims history in an uploadable 835 format. These reports to providers shall comply with HIPAA standards and include HIPAA standardized denial codes. The 835 reports shall also include the original submission date of each claim, as well as reprocessing and denials. The claims history report shall also include corresponding check number and accurate check date for the full or partial amount paid on the claim. Are you issuing the 835s with all of that required detail that we requested in the JCR report?
Thank you, Delegate. So the 835s that are being delivered, yes, they are in accordance with industry standard and the state's definitions of the requirements. Certainly, if there are examples where for some reason there are issues that individuals are either misunderstanding, or if there are examples of data error, we would want to know those. But we have strong confidence that the 835s are being delivered in accordance with standards.
With the standards that the JCR set out that I just read, with all of that data.
Certainly, we can carry that back and confirm, but the 835 was developed in accordance with the state and actually in accordance with provider feedback. The providers actually played a key role in the development of that structure. And so, Delegate, we certainly can take that back and provide a direct confirmation, but I'm confident that we have engaged that work in accordance with the state's requirements.
Okay, and then just a quick question. In your experience, it sounds like you're trying to work with the providers and trying to work with the department. Is it your understanding then, I think that Delegate Hill and some of the other delegates were getting at this, that these providers are having to go back and do manual reconciliations because the communication system still doesn't have standard denial codes and standard communication?
I can't speak to the specifics of individual providers and the tools that some of them use. In fact, we know that actually a very small subset of the provider community actively uses, the more electronic methodologies around 835s. But I wouldn't be in a position to speak to the specific business practices of the providers. But what I can say is that to the extent that a manual review is required, we are offering and actively engaging through the reconciliation managers to assist with any of that support. But I wouldn't be in a position to speculate on the details of the provider's business practices.
All right, well, thank you. We'll hear from the providers. And of course, I think you and the department recognize that we're talking about the delivery of behavioral health services to the Maryland citizens. And we're very concerned. I think that this process could be deterring a lot of providers from even engaging or participating in the delivery of this important service to Marylanders, given the severity of the dysfunction. So thank you.
Delegate Johnson.
Thank you, Mr. Chairman. And thank you guys for showing up to answer these questions. These are important. Several providers have said that they are not receiving or missing 835 receipts. So they have to spend more time calling, trying to get this information so they can reconcile, which takes away money that could go to the patients. So how are they supposed to reconcile if they cannot get their 835 receipts or are missing 835 receipts?
Thank you, Delegate Johnson. So what I would say is most certainly they are receiving the 835s. There are examples such as what was described earlier with the Beacon 2019 claims, where there are specific items there that will be updated. That's actually outside of the estimated payment period, but certainly we understand why it's so important. The example, what I would encourage all providers in the cases where they have examples that they believe an 835 is absent, we will work with those individual examples, but I can say with appropriate confidence that those examples are individual in nature. They are not systematic or large scale gaps. In some cases, what we've learned is that providers, the system, frankly, this is an awkward element of the system. Providers who offer services under multiple provider types, there are times in which they may have submitted claims through the inappropriate provider type, and therefore they may not be looking in the correct location for the 835. We've seen many of those examples, and and then of course it's appropriate for resubmission, so the provider is appropriately paid. That's certainly one example. And in the cases where there may be some form of systematic challenge that prevented an individual example from being delivered, we absolutely would immediately engage to get that corrected and get that in their hands. But I do not in any way believe that to be a wide scale issue.
Okay, and from several providers, I'm hearing that some 835s that they do get have the latest claim number that you have put on, and it does not provide the entire history of the claim. So it's very difficult for them to go back and find out what is going on with that 835. So can you speak on that a little bit?
That specific example, Delegate, I'm not sure that I completely understand. And if it would be okay with you, I'd like to commit to taking that example and following up with an appropriate answer. I'm not certain that I'm in a position to be able to speak to that very in-depth technical detail, but I will be glad to follow up.
All right, thank you. And if you'd like, I'm sure I can get you examples from the providers to send to you.
We would very much value that. If you're able to supply that, that would be useful. I appreciate it.
All right, thank you.
All right, are there any other questions for Mr. Burkholder? All right, seeing none, let's move on to the provider panel. And I do appreciate Mr. Burkholder and Mr. Shu and Mr. Yi continuing to stay on. I am going to guess, because they do meet regularly, that nothing that they're about to hear is new to them, but it's going to be new to us, assuming we have not been contacted by these providers directly. I think it's important to hear this, and what I would request, because I do not want this hearing to become a back and forth between the providers and the department and Optum. I would like for the department and Optum to listen to what the providers are going to say, and then to provide us with an answer in writing at some period in the very near future, so that we can get a sense of where you are with this. So with that, June, can you remind me the 4 providers that are on the list to speak? I don't have the agenda directly in front of me.
Sure, no problem. The first provider up is Lori Doyle from the Community Behavioral Health Association of Maryland. Go ahead, Lori. And I believe Shuri is going to manage your slides.
Wonderful. Lori, please go ahead.
Thank you, Chair Resnick and Chair Pena-Melnick. Lori Doyle here on behalf of the Community Behavioral Health Association of Maryland, and we really appreciate this opportunity to update you on the Optum issue. You've been hearing about this dysfunction for almost 2 years now, and it's really hard to overstate the impact that dysfunction has had on the provider community in terms of money, time, and diversion of scarce human resources. This is a very weedy issue, and we've tried to distill it as much as possible, but I have with me today Lauren Grimes, also with CBH, who is an expert on all things Optum. It's a full-time job, and she can answer any in-depth questions you may have. And Sheree, if you would go to the next slide, please. This is just a reminder to the committee of where we've been and how long this issue has been plaguing providers. Optum was awarded the contract in July of 2019, went live on January of 2020. Their authorization and claims payment system immediately failed, so providers were given advances or estimated payments based on their 2019 activity. Today, our focus is on reconciliation and recoupment of the estimated payments during that period of January 1 through January 3rd, 2020, because it is imminent and could have a devastating impact on providers. But we wouldn't be having this discussion today if Optum's system had been able to authorize services and pay claims, the 2 main things they were hired to do when the system went live. Estimated payments were a direct result of Optum's failure. Next slide, please, Sheree. Before we move into reconciliation and recoupment, just to mention that Optum's subvendor Encato continues to be inadequate to the job. Reimbursement of entire service lines, including residential crisis bed, continues to be almost wholly dysfunctional. And it is important to note that any fixes that were made to Optum's system after August 3rd, after that estimated payment time, won't impact the claims that were submitted during the estimated payment period. And those claims are still sitting there unprocessed. Next slide, please. In response to the ongoing Optum debacle, this committee and your Senate counterparts adopted budget language requiring the department to report on certain conditions associated with reconciliation, and it contained 3 prongs, if you will. The first prong dealt with the claims information providers need to check Optum's math in terms of what they owe, and Delegate Valentino Smith just read you that language, and it's contained in the first 3 boxes that you see here. And you can see the status of those first 3 on the right. And as you can see, Optum is 0 for 3 in this first prong. The second prong was for the department to hire a neutral, independent third party to mediate between providers and Optum to try to reach agreement on what is owed. So as you've heard, we now have the Office of Administrative Hearings. We have not heard of any, other than today, an MOU for some other sort of format. We're under the impression that we must, as a corporation, bring an attorney to the Office of Administrative Hearings. And certainly, even if it's not required, necessity would seem to demand such. So we're concerned that that's not obviously what we had in mind at the time. And the third prong was for the department to report on any fines or liquidated damages assessed against Optum. We're not aware of any. We heard Mr. Burkholder, but it's very unclear to us whether Optum is sharing in any of the pain that providers are feeling today. Next slide, please. So really, we need two things in order to get through the reconciliation process. We need time and we need accountability. So you've heard a lot about these 835s. We're getting them. We're not getting all of them. So much of the information has to be processed manually, and that's not because it's a small provider. We're talking anything from mom and pop up through the very large providers that we have to manually process hundreds of thousands of lines of claims, and that takes time. We also need that accountability. We have to be able to check Optum's math. Unfortunately, their system is a mess, and it has resulted in significant overinflation of back payment amounts, largely due to reprocessing of the same claims over and over, but treating them as if each reprocessing was a new claim. And I think that's why their numbers look so different from ours. Next slide, please. So this is sort of the original timeline. I heard Deputy Secretary Hsu talk about some changes to this. And so I won't certainly read this to you, but this is a critical matter. And so what we heard today is that we will only be required to pay back the duplicate payments as of December 31st. Now, we don't dispute that we need to pay back the duplicate payments, but again, because of the manual nature and the things that are missing on the 835s and the negative balances, we can't possibly get to that timeline. It's not that we don't want to pay it back, it's that we need to know what that number is. You heard about the whole claims history. We have been asking forever about a claims history that tracks every claim and the reprocessing of each claim. And so, you know, if a claim was submitted, it was paid, it was retracted, it was paid again at the wrong rate, it was retracted, all of these things, we need to know that history. We haven't gotten that. And I don't know if it's because Optum's system can't do it, or because if they do, it will show clearly the mess that has taken place over the last 2 years. So at any rate, from our provider's perspective, we need at least until February 25th to be able to wade through all of the data that we're now being hit with to come up with some semblance of a number. Next slide, please. So this slide really illustrates the difference between what providers say they owe and Optum's inflated number. So again, providers acknowledge duplicate payments. Optum paid us for services already covered by estimated payments. These duplicated payments were caused by Optum's error, but we know we need to pay it back. We also know that some providers saw a drop in reimbursable service due to COVID. So estimated payments that were based on 2019 activity may have been higher than actual delivered services. The big discrepancy is in these first three boxes. So that includes claims Optum denied in error, and it also includes claims that Optum says they paid, but the provider never got paid. They say we owe that back as well, even though these are Optum's errors. So we not only didn't get paid to begin with, but now we're told we have to owe the money back. And to make matters worse, Optum is now erroneously retracting payments for services that were paid under the last ASO beacon and adding that to the balance that they say we owe. Next slide, please. So you can see here, our numbers are pretty far apart, what Optum thinks we owe, what providers think they owe. In fact, you can see that for 38% of our respondents, the variance is 60% or more. And that can be a very significant amount of money. You know, you hear Optum and the department talking about, well, it's a few million here and a few million there. When you're the provider getting hit with that, it's a very significant impact and one that could really throw a provider off its feet. Next slide, please. So we do have a proposal, a counter proposal that we have given to the department. And it goes like this. We pay the duplicate payments back. We all agree we owe that money. Even though it was Optum's error, we owe it. We shouldn't have been paid twice. So we owe that back. In return, all of the claims for January 1 through August 3rd of 2020, the estimated payment period that have been sitting there would be paid by Optum, pay those claims. So that would leave the amount that is the difference between what providers were given via estimated payments and any dip in actual services due to COVID. Now, we would ask that the department consider forgiving that amount because you may recall that other provider types developmental disabilities, and long-term care providers had access to Appendix K waivers that provided them with retainer payments that protected them from the loss of revenue due to COVID. We had no such protection. So it would be something for the department to consider. But we think that this is a fair proposal. Next slide, please. And the reason why we think this is a more equitable approach than the department has offered, as you heard, forgiveness of $10,000 or less. But that ignores the fact that larger providers have the same razor-thin margins as small ones. While larger providers certainly take in more revenue, they also pay out more in expenses such as staff salaries and benefits. So unless they have another source of revenue besides the public behavioral health system, large providers are in the same financial predicament as small providers. Our proposal would take the time pressure out of the situation while allowing repayments to begin in the 12-month period timeframe that the department desires. It excludes providers who didn't do the work of submitting claims during the estimated payment period. So you can't get the estimated payment, submit no claims for that period, and then expect forgiveness. It avoids the appeals process and the expense of attorneys, and it cuts down on the administrative burden for the department, for Optum, and for providers. So we really hope that you as policymakers will support this proposal and that the department will agree to adopt it. Again, we're in this mess now, not because of provider incompetence, but because of Optum incompetence. So again, thank you for your time.
Thank you, Ms. Doyle. Appreciate that. Let's move to Mr. Michael Oliver from the Maryland Association for the Treatment of Opioid Dependence.
Good afternoon. Thank you to the subcommittee for taking this and hearing us today. My name is Michael Oliver, and I'm here representing the Maryland Association for the Treatment of Opioid Dependence. We are a provider and advocacy association comprised of the majority of the state's 95 opioid treatment programs. Maryland's OTPs provide comprehensive medication-assisted treatment for over 40,000 Marylanders with opioid use disorder. MATOD strongly supports the recommendations formally presented by CBH. Every program in MATOD has been negatively impacted by the ASO transition, and are incredibly nervous how Optum and the department has approached the issue of reconciliation. Some examples of these concerns include, but are certainly not limited to, the Encato system has not provided the claims information in a coherent and usable manner for providers to successfully complete this process. The timetable outlined is impossible to providers comply with and is unrealistic. There's concerns of data accuracy, fundamental issues surrounding which claims are included in the reconciliation period still go unanswered. Claims needing correction by Optum and Encato are still unaddressed, and the copious amounts of time and money providers are required to undertake to fix a problem that they did not cause. Each of these issues requires attention, time, and technical expertise in order to solve. This has not always been given to providers, and the recommendations by CBH addresses all these issues in a manner that is fair to the provider community as well as to Optum and MDH. I'd be happy to answer any of your questions regarding these concerns and provide more technical details needed. Thank you.
Thank you. That was to the point. Let's move to Mr. Craig Lippens from the Maryland Addiction Directors Council.
Thank you, Delegate Resnick and other esteemed members of the panel. I am the director of the Maryland Addiction Directors Council. We represent over 40 programs that vary from outpatient programs to residential treatment programs. We have thousands of beds in the state of Maryland. We strongly support the proposal that CBH has presented. There are several things that came up today that I took notes about that I think should be brought back to the surface here. Optum did issue some recon reports that listed checks for providers. Those check numbers that they listed did not match those that were received by the providers. This is a specific example of the difficulties that are presented by Optum's poor reporting. We've had a number of issues with recon reports, the recon managers. We've met with them, and in weeks, if not months, go by with us not getting follow-up and follow-through. We have had some providers within MADC that have been requested to make payments already. I would ask on behalf of the MADC programs that those programs that receive letters requesting payments be told that until they agree to the amount that is owed, that is not going to be enforced. They were told that they need to start making payments by the end of December. This has caused a lot of stress and anxiety for these providers. Many programs have had to repurpose their staff to now become Optum experts. I spend an inordinate amount of time going over the claims that have been submitted and the claims that have been processed. I took the time, along with my billing department, to give a color-coded spreadsheet identifying the claims that were submitted, claims that were paid, claims that are still outstanding. We have thousands, if not hundreds of thousands of dollars of claims that are outstanding that haven't been processed yet. I would request, though, that similar to what Lori said, and kind of in tandem with it rather, is that these claims all need to be processed and there needs to be an agreed upon number. And at this point, providers do not agree, nor do they have faith in the numbers that have been provided by Optum. I'm relieved to hear from Chad that there are new recon managers coming on board. I'm hoping that the time frame improves between the meeting with the recon managers and then the response to our responses. We do not accept carte blanche the information we're getting because we're seeing time and time again that there are issues with their math, issues with their reporting. As recently as this past few weeks, there have been changes to the 835s, but it's been a reduction of information, not an inclusion of information, which has created even further confusion. I'm very happy that this meeting is occurring. I'm hoping that changes can occur where we can move forward. There has been an improvement recently with the time frame of current claims being processed. However, the mess that occurred at the beginning and lingered is still creating this doubt that we have about the information that we're receiving. The MADC programs support the CBH proposal, and we also agree that providers that did not submit claims, they should be excluded from this proposal. But I do think, and I hate to be redundant, but sitting here for as long as I have and listening to all this, redundancy becomes kind of the modus operandi, is that I hope that the providers can be contacted and told that they will not be responsible for making payments until there's agreed upon number for those providers. Many of them are very anxious about this. Thank you for your time and your attention to this matter. I yield back to you all.
Thank you for that. And finally on the list, we will have Dan Martin from the Maryland Behavioral Health Coalition.
Thank you, Chairman Resnick. Can you hear me? Thank you very much, Chairman Resnick, Chairman Pena-Melnick. I'm actually on the provider panel, but I'm not speaking on behalf of providers today. I'm here with the Mental Health Association of Maryland. We're a consumer education and advocacy organization. And like you said, I'm speaking on behalf of the Maryland Behavioral Health Coalition. And I just want to take a really quick step back to kind of close out this panel to look at what this means for Marylanders writ large. Like I said, I'm speaking on behalf of the Maryland Behavioral Health Coalition, which penned a letter to Governor Hogan just over a month ago, highlighting the challenges that you've been hearing today that have continued for nearly 2 years, and urging and begging him to take some kind of action to resolve this issue. And it's easy to paint this as just an issue for mental health and substance use providers, but that is not the case. The frustration is felt far and wide on this issue. That coalition letter to Governor Hogan was co-signed by over 120 organizations from around the state. A number were community providers, but there were consumer organizations on that letter, family organizations, peer-led groups, a range of professional associations, hospitals, health systems, and more. And it's easy to get bogged down in the weeds on this issue. And in that letter, and what I'm going to try to do real quick right now is really kind of drill down to the core of these challenges and just lay them out in layman's terms. And so, try to make it easy for everyone to understand. And so in sum, what the providers are facing is that claims, receipts, and payments remain missing. Insurance coverage and eligibility functions do not work and continue to cause erroneous claims denials. Contractual turnaround times for authorization approvals are missed, delaying services to consumers. Guardrails preventing multiple authorizations by different providers for the same service do not exist, so services are routinely rendered by authorized providers and not paid. Plans for the recoupment of unverified overpayments continue to move forward despite the lack of reliable data to reconcile historical payments and services. Manual interventions to address claims processing failures are plagued by insufficient staffing, resulting in missed deadlines and vendor failure to meet contractual system performance standards. And lastly, Optum continues to not be held accountable for contract deliverables. And so I ask everyone on this panel, how is anybody supposed to run a business like this? We are experiencing increasing demand for mental health and substance use services coming out of this pandemic like we have never seen before. We need our community providers' focus to be placed squarely on serving the public, but it's hard to focus on expanding service delivery, providing services, when you have this administrative nightmare hanging over your head day in and day out. And I am super happy to hear that the Department of Health is getting started now on an RFP process for the next vendor, but that does nothing to ensure that the next 3 years of this current contract won't be fraught with the same types of challenges that we spent the past 2 years working to address. And then look, I recognize that everybody is and has been working really hard to fix this. This Optum, the Department of Health, the providers, but we have to place consequences where they are deserved, and that's with Optum. It's their dysfunction that is causing these problems. You know, this is not the first time there's been a vendor transition in the state. We've been operating under the system since 1997, and there have been multiple vendor transitions, and never has this level of dysfunction, has there been this level of dysfunction. And so, again, it's their dysfunction that's causing these problems. They should be the ones on the financial hook. Consumers and providers must be held harmless as these reconciliation plans move forward. I think the CBH plan is a creative plan and equitable plan, and I encourage you all and the department to really look at and consider it. And so thank you for your time.
Thank you, Mr. Martin. Any questions for anyone on this panel? Delegate Pena-Melnick.
Thank you so much. I really appreciate you coming here today. I want to go back to my question that I had to the department when I was asking about the proposal that was presented to them. And the proposal that I was referring to is a proposal that Ms. Doyle discussed and presented. So I assume, Ms. Doyle, if I may ask you first, you did present that proposal to the department, correct?
Yes, we have.
And when did you present that proposal to the department?
I'm going to say it was probably 2 weeks ago, a week to 2 weeks ago.
Okay, and have you heard any, have you received a response?
The response at the time, I think, was that the department felt that that would leave too much money on the table, not paid back.
Okay, so let me ask the department, because I wasn't specific about, in all fairness, to what the details of your proposal. So to the department, if I may, the best person that can answer, you know, what you saw this proposal and what's your reply?
If Lori, if you wouldn't mind bringing your slide back up, we can take each piece in turn to the best, as best we can. But the major plank of the proposal to forgive the outstanding balances is just not financially feasible. But more importantly,
so what I'm looking for, if I may, what I'm looking for is to see where there could be compromise, right? And see what's left on the table. Is that okay? Could you tell us?
Well, Delegate, I think the first question is very simple. I think that if we were to say the state would like to write off $230 million.
We're not even going to go there because we know that that's not on the table. I am concerned about the other proposal. Can we go through those? Is that okay? Can we go through that, please? Lori, what are they?
If I can interrupt, Cherie, if you can put up the slide from Ms. Doyle's presentation that had the 3 sections on it with the ellipses.
It was the second to last slide, Cherie.
Yep, just taking me a second to get to it.
And just to be clear, I'm not asking the state to lose money, but what I'm asking is to see where could there be compromise here. And the reason why I'm asking this question is because this has been going on for so long, right? And you'll be meeting with the providers, you know, all the time, but there's no progress being made and the providers feel that way. And I'm so concerned about the mental health issues, and especially with COVID, and we need people to have coverage. So I want to see where could compromise be had, if I may, with all due respect. And thank you for, being willing to answer this.
Madam Vice Chair, I think this is a very confusing slide to at least us over on this side of the video screen. We'd be happy to have further offline conversations about this topic. I think it's important for us to note that we work on a weekly basis with Lori Doyle and all of our stakeholders. We make the compromises, we value their input, we work with Optum. I don't think that anybody here can say that the Department of Health has blown off someone or refused to compromise or refused to negotiate in good faith. We've been working with folks since day one on this issue.
If I may, Lori, can you please explain what you're asking for here?
Sure. So the duplicate payment claims, those things in sort of the light blue, we all agree we need to pay those back. We pay them back. Of course, we need the time with the 835s to make sure that number's correct, but we all agree in concept that we pay those back. The green 3 boxes at the top are either claims that have been sitting in Optum's system since the estimated payment period, are just sitting there, have not been paid, or have been denied in error, and now also including the 2019 claims that were paid by Beacon and are now being retracted, that all of those claims be paid to providers. So we've got the duplicates that we're paying back, the claims that are sitting there or retracted in error, we get paid for. And so what's left is the difference between what we got in estimated payments and what we were actually rendering in terms of services. And some providers saw a decrease in services due to COVID. Others actually saw increases, so it may be different. But that variance is what we're talking about here. And we don't think it's anywhere near what the department is thinking, this 130 million. We think what they're seeing is this inflation of claims being processed and reprocessed. And so until we get the information that we can go through to say, here's what the number really is, then we're still apart on that final line at the bottom. And that's where I think the dispute is, although I can't speak for the department, whether they're also willing to do the top 3 boxes as well.
So Ms. Doyle, what information do you need?
We need that full claims history. We need a claims history that says this claim was submitted on such and such a date. It may have been reprocessed once, twice, 15, 20 times, but it shows all those reprocessings, and that we can finally determine what happened with it. Once we have that, then it'll take a little time, but then we can have that bottom line available.
So to the Department of Health, can that information be submitted? Can that information be provided?
Yeah, I think Lori's clarifications are very helpful. I do think we should take these discussions and bring them into our regular cadence of meetings where we do meet with Lori Doyle and her colleagues and go through each of these planks. I think we're in agreement on duplicates. We're probably in perfect agreement on claims denied in error. We've discussed that earlier. The denials, she's absolutely right. They're an issue. We understand why they're an issue, and that's partly why we wanted to defer the actual collections of outstanding balances to the spring, because as those denials are reprocessed, the total bucket of denials goes down, and as it goes down, they get credited against what is owed to the state. So it's to the benefit of the providers to have those denials reprocessed and credited properly. We agree. So I don't think, Lori, you and I disagree on very much here. And I would say let's take this to our regular meeting schedule and work it through.
All right, that's fair, because I'm putting you on, I'm putting you on the spot, and I thank you for your flexibility. I really do. So what my point here is, if you could go back, you could go through these points, what she's asking, those numbers, when the claim was submitted, it's not unfair to ask. So thank you for considering that. And I love to be able to, I don't know whether Mr. Chair will entertain another hearing or another meeting with us for you to report to us where did you get through those buckets. And thank you so much for your flexibility. Okay, I really appreciate it, Mr. Chair.
Thank you, Delegate Pena-Melnick. There's a bunch of other questions. I want to follow up just on this one issue and highlight what Delegate Pena-Melnick said. We do need to have a follow-up meeting on this. We are now well into 2 years in this process. If we're not talking about collections till spring, assuming that process is still going and is on schedule, this whole thing is not going to be resolved until the next governor is in office. We may have a new governor, we may have a new Secretary of Health. It may be, a long time. When Delegate Pena-Melnick asked the department whether or not they've considered CBH's proposal, we didn't get that answer. Even though you've had this proposal for 2 weeks, we started getting an answer about, well, we've gotten a lot of proposals and some of them asked us to get rid of everything. You couldn't just answer, yes, we've gotten that proposal. And in fact, since you meet daily and weekly by your own words, since you've had this for 2 weeks and you met last night, the fact that you haven't even discussed this in that period of time, frankly, doesn't give me a lot of hope that this is something that's going to happen in the near future. So we're going to have a follow-up meeting on this, and we're going to see what progress we've made. The biggest issue I'm seeing is that there isn't an agreement on numbers. There isn't even an agreement on the data that needs to happen before this reconciliation can take place. Now, before I go on to the questions, I need Mr. Burkholder to commit to this group that you are not on the 835s. You're not only going to provide the 835s, but you are going to provide the full claims history on every claim in those 835s so that these providers can give you the information you need, pay back what they need to pay back, and get paid for what they need to get paid for. Can you do that? Is Encato capable of doing that? And if not, how are you going to fix that?
So my commitment will be to take back to evaluate what specifically can be adjusted according to what's already been offered. To be frank, and I'm not in a position right now to make a specific commitment without first consulting the technical teams that would be able to help me understand, what has been delivered, what is capable of being delivered. But we will gladly follow up with you on that. That's the best that I can commit to at this current time. Delegate
Can you acknowledge at least that the providers have been asking for the full claims history? And that has not been provided?
So I think that we would disagree that claims history has not been provided, but I can certainly acknowledge that the methodology that the providers are requesting, they're asking for something different, and that's what I'll acknowledge. So at this time.
All right, we're going to go to Delegate Bagnall, then Delegate Johnson, then Delegate Hill.
Thank you, Mr. Chair. And I want to follow up on my vice chair's comments and just open the aperture a little bit so that we are, remembering the context in which we're having this conversation, that this was, this crash of the system was occurring during a pandemic when the providers that are on this call were essential workers providing essential services. And my question to the providers is, if you can speak to the margins at which you operate, what the impact would be on our network adequacy, meeting network adequacy, if we are not able to resolve this issue and these outstanding payments, and what the overhead for our providers is in terms of just having administration available for these reconciliations, for these manual reconciliations. And whoever is most equipped to answer the question.
I would probably defer to my provider colleagues on the call. I will say, though, that providers in general have a very limited amount of cash on hand, usually a payroll or two. So to the extent that payments are delayed, or we're spending money on overtime, or individuals dedicated strictly to Optum, it hurts. we just don't have that kind of financial flexibility. But let me turn it over possibly to Maytod or Matsy.
Hi, I'd be happy to answer. So we agreed wholeheartedly with CBH proposal, including the vast discrepancies in the amount of money that's owed by specific providers. In many of our internal phone calls through Maytod, providers are seeing outstanding balances that would put them underwater, that are significantly different from the amount that they have billed to Optum during that time period. So the data set that they're looking at is wholly incorrect in a time where there is a workforce shortage, so we can't even get staff in the door, that they are being faced with the administrative burden and the financial burden of having to go through all these claims line by line. It's a lot of work day in, day out in order to be billing efficiently in order for these programs to stay open, on top of having to either add extra staff or pay extra hours or spend extra time in order to be able to effectively work through this reconciliation, which is being doubly difficult when we don't have all the information provided to us that we need to reconcile. We've been asking for, what I have been asking for personally on behalf of Maytod, is a streamlined claim processing history. This has been going on in the Operations Improvement Committee for well over 6 months. This request has been asked, and we don't even have that. So the ability for whatever extra staff we're hiring and work through to do that, it's simply not available to them. So not only are margins tough, but there's a lot of anxiety and nervousness in the field of if a rushed reconciliation process is happened and that they don't have the ability to agree on a number, then they're stuck between the rock and a hard place of even needing to pay money to hire outside counsel to defend themselves, or being forced to pay back a number that puts them in a cash flow crunch that might impact the amount of services that they can provide and the number of staff they can hire. So it's a terribly difficult situation, compounded by the fact that we don't have the information to negotiate it successfully.
Thank you so much. And thank you for that very thorough answer. Mr. Chair, if I may follow up, I just wanted to give that context as the department is considering the proposal by CBH, because it has been the legislative intent of this body to hold other agencies harmless for the impact that was created by the pandemic. We did that with the schools. We did that with the Department of Labor. We did that with other aspects of somatic care. And so I just wanted to make sure that we were keeping that context in mind as we are considering the multiple buckets that were proposed by CBH. Thank you so much.
Thank you very much. Delegate Johnson.
Thank you, Mr. Chairman. This question is for Chad. When providers submit a claim, it's through the Encato portal. But when they get the documents to reconcile, it's from Optum. Now they can go into the Encato portal and see the claim as it was the last claim, only the last claim, with the last claim number on it. If it's been processed 15 times, they're only going to see the last one that was processed. So why can't they go into the Encato portal and get the whole history of the claim, where then they could do their own reconciliation? Why is it that you have that information, but they have to wait for that written information from Optum? To me, that is just creating steps, delays, confusion, mistakes, oversights. Why is it they cannot go right to the Encato portal and see the whole history of the claim so they could do their own reconciliations? And we would have a true number of what they owe, because if it was claimed, if it was processed, it's in that portal, and those are true numbers.
So that's correct, but I think what you're describing would be incredibly difficult for the providers to do that, claim by claim by claim. The electronic logs that are sent, 835s, et cetera, are intended to offer a mass amount of data at a specific, over time, that makes it easier for that to be processed. Now, I think what we've heard from the providers today is that the methodology and the specifics of that 835 delivery is still very difficult for them. as I mentioned to Delegate Resnick. I certainly, I will absolutely go back and understand what the options are to revise the way that data is being shared. But you're correct in that providers could go into Encato and look claim by claim. But that's to be very fair to the provider partners, that's not a realistic expectation for a group that does mass amount of business. So that's why that would be difficult for the providers. Delegate Johnson.
Are they not looking at thousands of lines of data now in the 835s?
They are, that is correct. But I think that the process, and certainly the provider community is welcome to chime in here. I think that there is first of all, the 835 process, many providers actually have been successful in electronically uploading what they need to and then using that. Not all have, and we've heard some examples from that today. And there could be various reasons why that could be the case, including local tools within their, that they're using in their businesses. But I think it's a matter of practicality in fairness to our provider partners.
Well, they were able to do it through Beacon and it seemed to work. Mr. Chairman, can we hear the chime in from the provider committee or the provider panel on that question?
If we can have one person respond, that would be fine. Lori, do you want to take that?
I would throw this one to Lauren. She may have a better understanding of how that portal works. Thank you.
Ms. Grimes, go ahead.
Sure, I'm happy to. Thank you for the question. To give a kind of clear explanation of this, the phrase full claims history has been tossed around a couple of times throughout this meeting. And I think what providers are asking for is, given the fact that there have been undue amount of errors that have caused the reprocessing of a single claim, sometimes 15, 16, 20 times, in no place, either in Encato, on 835s, or in PaySpan, can a provider go in and access the full life of what has happened to a claim. So Encato creates a new claim ID for every reprocessing. So what a provider has at their disposal at any given time is only what last happened to that claim. So we have had 2 years of getting incorrect check dates, incorrect check numbers, claims being paid at the wrong rate, claims being denied erroneously, claims being reprocessed. So a provider cannot access the full history of anything that has happened to a single claim. It all comes individually. And to give you a little bit of an example, throughout 2020 in the estimated payment period, there were disappearing claims that were not making it into Encato for months and months and months and months. And providers kept saying this, and it was finally acknowledged that that was indeed happening at the end of last year. And so providers were given a list. Some of the larger agencies, this list was more than 1 million lines long that they went through and had to resubmit every single one of these claims that went missing. That is the manual portion of this. And in order to connect check numbers with check dates with each reprocessing, they have to go into different places on different 835s in Encato in PaySpan and recreate that history because it exists nowhere in one place. Does that help? I hope.
That does, and thank you very much for that A to Z explanation on what's going on. I appreciate it. Thank you, Mr. Chairman.
Thank you, Delegate Hill, and then Delegate Valentino Smith after.
Thank you very much. This is for the department. And really, I guess it's a statement. When you sit down to discuss the proposal and you look at, I think your statement was it was leaving too much money on the table. I hope that you will be looking at what the state has agreed to pay for the Optum contract, what the non-performance recoveries are expected to be from the Optum contract, and what monies may be available to the state from the one-time federal funds that have come through during the pandemic that are designed and what the state has decided the legislation with the governor have decided to use for one-time fixes, because this situation certainly qualifies as a one-time fix for use of federal money, particularly as there are components of this fiasco that are related to the unusual circumstances and predictions of behavioral health related to the pandemic, even though much of it is simply related to a poor contracting deal. So when you talk about how much money we're going to leave on the table if you accept this proposal, understand that there should be some money coming back in addition to whatever the providers agree to reimburse. Thank you. Is that something, the question is that something that you will be willing to take into account?
Delegate Hill, thank you for your views.
Not sure that was an answer, but we will have to.
I think it was a no.
That was yeah, okay. All right, Delegate Valentino Smith.
So thank you, Mr. Chairman. And again, everybody has asked about this full claims data, and I just want this to the department now. You have heard Ms. Doyle say, and you heard Ms. Grimes just lay out, that the problem has been a complete failure to get claims history in an easy, accessible, one claim, here's the full history on, if I understood Ms. Grimes correctly. And Delegate Pena-Melnick, Delegate Resnick have asked you, will that data be available? And I specifically read to you, I hate reading, but I read to you out loud to the department when we left session that the 835s would specifically include all of this information. And I asked Mr. Burkholder, are you in compliance with this? And he said that you guys agreed that he was in compliance with some industry standard. But we expressly as a legislature said to give them all of this claims history on the 835. And so I ask you, and everybody's raised this, the department, if you have not required Mr. Burkholder and Optum, or to make sure that Optum's having in Cato, making sure the providers have full claim history, how can, if you have not done that for them, again, how can you say that it's your responsibility to retract all you in that memo, your moral responsibility to get back overpayments and everything, when you have not done what you need to do with the provider? Your responsibility was not, if you had fulfilled your responsibility, the providers might not be in this position. But your failure to enforce the contract, to follow the budget language, to get them the full claims history is what has them now vulnerable from a financial perspective and operations perspective. And so did you or have you not insisted on this from Mr. Burkholder? Have you asked him? Maybe it's the department that's not insisting on full claims data. I'm unclear here.
Madam Vice Chair, the department has requested that Optum commit to certain actions. And then to parts of your statement, I'm not quite sure if we fully got that, so I think we may have to agree to disagree a little bit. But again, we welcome offline conversations about that.
So in closing then, you're affirming that it is department's responsibility to make sure the providers have the full claims data in an accessible format that they can work with to address what Ms. Grimes attested to you. That's the department's responsibility.
Madam Vice Chair, we have asked for that information, and the system is apparently incapable of providing it.
So is that a failure to meet the contract then? Is that where we're going to talk about getting the penalties and the punitive damages or non-compliance that Delegate Hill and I and everyone have raised back from Optum so that you can shift that money to the providers to help them?
And again, we are in close consultations with our Assistant Attorney General about this issue. The department and the state reserves all legal rights and remedies.
Well, I thank you for being honest and admitting that there's been non-compliance with the contract. Thank you.
Thank you. Are there any other questions for anyone? If not, I want to end it with just a statement from me, because I'm going to take some action moving forward as well. And I'm hoping that my colleagues will join me on this. As I mentioned earlier, we are 2+ years into this, and we are probably going to continue to see this well into the next administration. There has been an admission from the department that the system is not able to provide the full claims history in the way that the providers are able to reconcile, to be able to prove whether or not a check that came 2 years ago has the right check number and therefore needs to be sent back, or any other way of being able to reconcile this information. So if we cannot resolve this, I'm going to be having a conversation with the Chief Procurement Officer of the state and with the state Attorney General to look at the contract with Optum and to see if we need to bring in, and we can do this either through budget language or legislation, if we need to bring an independent auditor like Ernst & Young or Price Waterhouse or somebody like that at Optum's expense to do the full reconciliation outside of the department and outside of the providers. I feel like that's the only way that we are going to be able to do this properly, and provide them with parameters about what is considered a reimbursable expense, what is considered an expense that needs to be repaid, that if there is not enough data to be able to back up a repayment, then that needs to be forgiven, etc. So we may need to bring in at Optum's expense, and I emphasize this, an outside independent auditor to go through and do this reconciliation on their own outside of everything forward. And then when they are done, checks and payments will be made, but Optum's sole responsibility at that point will just be moving forward. So that's what I'm going to inquire with the Attorney General and with the Chief Procurement Officer as to whether or not the contract could allow that or the law can allow that. And then we will take action in the next legislative session one way or the other. Because as I mentioned, I think we are all tired of having these conversations. I would also ask the department, in addition to sending responses to all the questions that were asked, if you can also please send to the committees the signed MOU with the Office of Administrative Hearings that you have engaged with, so that we can see exactly what terms have been agreed to for the mediation and what the definition of mediation is under the MOU. So I will ask them to send that as well. We have in front of us a JCR report that's waiting for approval to release funds back to the Department of Health. I am sitting on that report and not approving it until we get these responses and other information. So with that, if there's anything else from anyone on the either committee. Seeing none, we are about 5 minutes over, so I apologize for that, but we're right about on time. I want to thank everyone for their time. I want to thank everyone for the work they're putting in on this. We're not there, but it is my hope that 2022 is the year we get there. So with that, I believe we are adjourned. Thank you very much, everyone.